Hello, my name is Kassie Bollig, and I'm a physician at Reproductive Medicine Associates in Basking Ridge, New Jersey. I'm originally from Southwest Missouri. I grew up on a farm there. I attended undergraduate school as well as medical school in Missouri before I came to Philadelphia and trained at Penn for my fellowship in reproductive medicine. I'm one of 4 kids. I have 3 brothers. My mom did not follow the interconceptual spacing rules, so there are 4 of us born in 5 years, but that made for a really fun and challenging, but mainly fun childhood. Every day we woke up, did our chores, went to school, went to our school activities, did our homework, did our chores, and went back to bed. There were no excuses. You had to get your job done, and I think that instilled in me from the beginning a very hard work ethic that I continue even now in my practice. My first delivery actually was of a calf, and so when I saw my first human delivery, it didn't seem like that big of a deal and much more controlled environment, I would have to say. So maybe in some ways, growing up in that environment did sort of pique my interest in reproductive medicine, but really it was a love for science that made me first think about going into medicine. I feel so lucky to be able to be doing what I'm doing, that I get to be a part of something that's really important and also really hard. Often when patients are coming to you, it's been a long time coming. They've been through a lot. It can be a few months, it can be a few years, and no one wants to come into an infertility office. We know that. So I want them to know that, look, I'm here for you. You're not alone in this anymore. We're now a team. I'm invested in this, just like how you guys have already been invested in this. And I think that relationship is really special. After the initial consult with patients and they finish completing the initial workup, I always meet with them again in a follow-up to go through all the results and make a plan. One of the most frustrating scenarios can be when all the results come back normal. Often the couple will say, well, if everything's okay, why can I not get pregnant? So I think it's really important in those scenarios to just reflect on how hard the process of becoming pregnant actually is. And there's a lot of things that we don't either understand or we can't really test for. So importantly, I always stress that just because a test isn't positive doesn't mean that there's something that's not going on. So we will make a plan based off of the information we know, but going forward, we often find out more and we can tailor things, shift things to really provide the best possible treatment and then hopefully get a pregnancy there in the end.